to the Minister of Health and Long-Term Care. Minister, last year you and the Premier were sent a letter from a family doc in my riding who outlined the negative impacts your government's cuts to physician services would have to patients in her group practice. In the letter, the doctor warned that as a result of your cuts, they were considering shutting down their blood lab. As of January 1, the lab is closed. This government's actions are resulting in cuts in essential services that residents in my riding and across Ontario rely upon. After the minister received this letter and I raised this issue with him, did the minister meet with Dr. Meg or respond to her concerns?
Thank you. Minister of Health and Long-Term Care.
Well, Mr. Speaker, I have to admit that I'm somewhat confused by the line of questioning, because the question prior to the new member from Whitby implored us to make further investments in mental health at Ontario shores. But then the supplementary referred to his wanting further investments for our doctors, Mr. Speaker, and this is the line of questioning here as well. We are investing new dollars, Mr. Speaker, in mental health services, $138 million over the next 3 years. We are increasing our physician services budget this year compared to last year. We'll increase it again in the year following. But, Mr. Speaker, we have to make sure that we're providing the patient-centred care that Ontarians need and deserve, and that requires sometimes asking our physicians to hold the line. It requires our best-paid physicians in all of Canada to hold the line so we can invest in home care, in mental health services, in all of those services that Ontarians hold dear when they do face those health care challenges and need our help.
Supplementary.
I don't know what's so hard to understand. Last year in Dufferin County there were 5 labs. Now there are 2. A 73-year-old constituent now has to travel 30 minutes each way and wait in a line outside in January because the lab in her hometown has been shut down. The only remaining lab in Orangeville was closed between Christmas and New Year's. This is completely unacceptable. Will the minister restore funding to physician services in the upcoming budget so patients in my riding can receive lab services they need without having to stand outside?
Thank you.
Seated, please. Be seated, please. Thank you. Minister.
Again, Mr. Speaker, I find it difficult to understand. On the one hand, the member is asking us to increase our investments to community labs, and on the other hand, she's asking us to give more money to physicians. Mr. Speaker, I have to reiterate what I did earlier, to reiterate that physicians will continue to be compensated for every single service they provide, and to ensure that we stay within our budget, which is increasing for physicians each year. To stay within that budget, Mr. Speaker, we're reducing modestly the amount we pay for individual services, but there are no limits to the number of patients that a physician can see. No physicians will ever be asked to work for free. And on average, the discount that we've applied, that modest decrease in compensation, if you were, on average, as they are, a $368,000 physician receiving that level of compensation from the government, this would result in that amount decreasing perhaps to about $350,000, Mr. Speaker. But there's nothing that prevents physicians from extending their hours, seeing more patients. There's no cap.